Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello and welcome to the Massage Therapy Foundation Research Perch podcast. I am your host today, Robin Miccio. I am the chair of the foundation's case report contest, and I am so excited to be podcasting with our 2025 Case Report Silver Award winner, Hailey Robertson. Hailey is a recent graduate of Miccio University program out of Edmonton, Alberta, Canada. And we're just so happy to have you, Hailey. Welcome.
Thank you. I'm so excited to be here.
I have to say, I've been reviewing case studies for many years, and I was just really impressed with your findings, but really energized by how you used information from the existing literature to inform your treatment approach. I thought that was like the shining piece of this case report. So I'm excited to dive in and just review this with you. So before we actually jump in, do you mind sharing a little bit about yourself?
I was born and raised in Edmonton. I've been here my whole life. I actually grew up just outside of town. I'm a farm girl through and through. And then before school, my background was actually all sports. I worked with football teams, doing some like athletic therapy stuff. I'm coaching volleyball. So when I came into school and kind of stumbled myself into like the neurological research and that stuff, it's been very different, but very exciting.
Awesome. This seems like a perfect field for you with all that sports background. So
Yeah, definitely.
wonderful. So let's jump into the case report. Can you give our listeners just a snapshot of the case report? So what was it about and what really drew you to this topic?
Yeah, absolutely.
Well, let's
So,
start with, sorry to interrupt, let's start with the actual case report title itself. So, this is a case report on massage therapy for multiple sclerosis. And yeah, give us a little bit of background.
sure, yeah. I met with this patient during my time at McEwen University. So, I was in my fifth of six semesters, and we were in what we call clinical five. So, in that clinic, you're meeting a lot of patients with neurological conditions and like complex conditions. So, a lot of people are actually coming in wheelchairs,
Hmm.
and it's kind of like our biggest kind of clinic of the year. Like, it's kind of what we all work up to.
Hmm.
So you get two patients, and I selected this patient to write my case report on just of how unique her situation was. So my patient, she was 27 years old, and she had relapsing remitting MS. So actually her original symptom was unilateral vision loss. And then as her symptoms progressed, she started to see a big decrease in mobility. So when she would get her flare-ups and relapses, her biggest thing was her mobility. And she found that to be a big issue because of like spasticity and tightness and just a restriction in range of motion in kind of her lower extremity.
Hmm.
And that was kind of her main complaint. As before our treatments, she had mostly been treating her symptoms with medications. She had a little bit of previous history with massage, but like nothing significant. Like she never, like she kind of came in saying like, I've had massage, but it's never really like had an impact on what I've been doing.
Hmm.
So that was kind of cool. We really focused on the range of motion aspect alongside she also had some like non-specific vertebral pain that would kind of come with her flare-ups. And then her other main complaint was she was tired all the time.
Hmm.
So we chose a few like measurement tools. We were measuring the lower limbs with goniometers before and after each appointment. We were using the numerical rating scale for pain to kind of track that pain she was having. And then we also used the modified fatigue impact scale to kind of track that fatigue, but we only administered that one after every second session.
Okay.
Yeah.
And can you tell us a little bit too, just about the intervention itself? So I know you used a variety of MT techniques, but you were
Mhm.
specifically looking at what?
So I really wanted to focus in on PNF. So I'd kind of used PNF in the past in the athletic field, but I'd never really used it with this group of patients before. And so PNF itself was actually originated in the late 1940s at the Quebec Kaiser Institute.
Mm-hmm.
And it's actually kind of funny. It was actually originally used to treat polio patients in
Interesting.
neurological research. And
Uh-huh.
then it kind of transitioned into what we know of it today of like really used in the sports atmosphere and with like not even non-athletes in like an injury rehabilitation setting. It's really
Mm-hmm.
common like physiotherapy and that stuff. Um, so yeah, I really just was excited to focus on the PNF and really wanted to focus on improving her range of motion.
Wonderful. And for those who are not familiar, PNF stands for proprioceptive neuromuscular facilitation. And can you just describe what that intervention looks like?
Yeah, so it's pretty much combines like passive stretching and then muscle contraction to improve flexibility, range of motion, and improve a little bit of muscle strength. There's lots of different kinds of PNF. So there's like a hold, relax, contract, relax, and then there's one that we call contract, relax. I don't really actually know what it's like
Yeah, yeah.
CRAC. It's a big long word. Um, but I used mostly hold relax in my research. So pretty much what that looked like is we would stretch out, we'd stretch to the end range, we'd hold
Mhm.
a muscle contraction in that stretched end range, and then we'd actually stretch a little bit further and repeat the process. That was mainly how we used it.
How did she react to that? Was that difficult for her?
Yeah, a little bit. So she was actually like kind of like when I told her what we were going to be doing, like you
Yeah.
could tell we were like a little, I mean, we were both a little bit nervous. Like I had never really done it like in that
Mhm.
setting before. I didn't know what
Mhm.
to expect. Um, and she was like, "Yeah, let's try it." And the first time it was actually like it was really difficult. Like she had a lot
Yeah.
when she would like activate her muscles, she'd get a lot of tremors. So there was a lot of shaking and I was when I first did, I was like, I don't know, should we keep going? And she's like, no, this like it, I feel like it's actually doing something like let's keep going. And as we kept going, it really like you could start to really see a big difference.
Wow, that's
Yeah.
great. That's great that she actually noticed that like she felt like it was working. That's really
Hmm.
exciting. And I know this is like the best part of the case study, but let's go kind of like in order of the study itself, starting with the introduction. So
Yeah.
during your literature review, as you were looking at MS and PNF and massage for MS, was there anything that really stood out to you in the literature review? Any findings or insights that helped influence your treatment plan?
Yeah, absolutely. So there was so many. I was actually surprised how many people had studied MS and massage before. But all of it was focused on Swedish massage and reducing pain and fatigue. There was so many studies and so many, there's even like a paper that was published out of McEwen a few years before me that talked about MS and massage. But kind of the thing that I kept realizing with these is either they didn't study range of motion or the ones that did study range of motion had no results. They said there's insignificant change
Hmm.
and there was like the range of motion just wasn't changing. And I kind of found that frustrating at first because that's mainly what I wanted to change. Like her
Hmm.
pain and fatigue was there, but like it wasn't her main issue that she was seeing day to day.
Hmm.
So I actually kind of went out on a whim and I was like, okay, what can we do for range of motion? And I started looking at PNF and I came across a few studies that used PNF in post-rehabilitation of stroke in stroke patients. And it was very cool because I had to look for like people, another neurological condition that
Yeah.
experienced spasticity. And I was like, you know what? There's so many parallels from my patient to these patients that were seeing this improvement. So let's try it. And that's really what drove me to try PNF with this patient.
That is so exciting to hear that you were really able to connect the dots. Like, even though you weren't seeing exactly what you were looking for in the literature, you saw that there was a need to add to the literature with this particular case report. And I think that's what gives me goosebumps. I'm like, yes, this is exactly what we were looking for. And you looked at other studies that you could say, okay, plausibly, I could use this technique to support the patient because it's also a neurological disorder. So I love that you really thought of that and connected the dots there. Now, can you walk us through your well, I know you actually talked about the techniques. You did mostly PNF. You also did Swedish, correct? Were
Yeah.
there any other techniques that you incorporated?
No, not at the time. I mostly focused on like just like gentle Swedish massage. And then I do some like the hold relax, mainly for like glutes, hamstrings, quads were kind of the main three muscle groups I focused. And then I'd kind of just like finish that up with some good flushing and like range of motion stuff. I
Hmm.
was really nervous to kind of because there's also so much out there about like exacerbating relapses. So I didn't want to overdo anything
Hmm.
and that we were already doing the PNF. I kind of didn't want to push it too far. And I also really wanted to keep my study pretty specific to PNF. I didn't want to like add in like a bunch of
Got it.
fascial work and a bunch of that stuff because it would be hard to then really say what PNF was doing for her or not.
Yeah, that makes a lot of sense. And then when you did that initial assessment, did you find anything that surprised you or shifted the way that you actually planned to work with her through the intervention?
Yeah, so I was actually, my previous experience with MS was pretty limited. And the only people I really had ever worked with or knew with MS, it was quite advanced. They were pretty wheelchair bound. Whereas this patient came in and she walked in on her own, you would have no idea until she told you. And that kind of really
Mhm.
opened my eyes to like how much we could do. And I think that's also kind of what pushed me down the PNF road because I was like, wow, she's actually very mobile. We can actually really like we can still work, like do a lot for her. And that really surprised me. I was kind of actually scared waiting there, like reading the file before I met my patient. I was like, what am I
Yeah.
gonna do?
Yeah.
I was like, I was like, didn't know what to expect. So I think just like the shock of like seeing how mobile she still was. I mean, when she had her
Mhm.
relapses, like she would sometimes come with a cane or something like that.
Right.
But when she was like having a good day, she was just like your average person.
Wow. And it sounds like you really worked together with her. So it was like a relationship where you could get the feedback and make sure that you were really get like doing something that would benefit her.
Yeah.
Um, what kind of home care or self-management strategies did you recommend between the sessions?
Yeah, so I actually taught her a simple PNF stretch to actually just do by herself at home for the glutes and for the hamstrings. Not like as intense as what we were doing in the clinic setting, but definitely like something just for her to kind of I really want to get her continuing to use that range of motion that we were gaining. That's like one of the big things with PNF is if you don't use that new range of motion that you've established, you're just gonna lose it. So I really wanted
Mhm.
to like have something for her to keep working on between sessions so that we weren't starting from scratch every single time.
That's great. How did she do with the home care?
She
Did
was a
she adhere?
trooper.
She was, yeah.
She loved it. Yeah, she was good at it. Sometimes you never know with home care if people are going to do it,
Yeah,
but you could
exactly.
tell
But
that
yeah,
she
I think it
loved it.
takes like it's again the partnership,
Yeah.
and encouraging them to have that agency to do things in between. So as we kind of move through here, let's look at the findings and the results. So I know you said you chose to look at pain, range of motion, and fatigue as the main outcomes. Before we dive into what your findings were, what helped you guide that decision to use
Mhm.
those outcomes?
Yeah, so I really went off of like what symptoms affected her the most, especially because MS is so specific to each person. Every single person with MS experiences very different symptoms. So we had decided that range of motion in the lower extremity was definitely like her main thing. That was like her primary focus. And then pain and fatigue seemed to be like the secondary things that affected her every single day. So those were why we decided to focus on those three things.
Very nice. I think it means so much when you're choosing outcomes that are meaningful to your patient. So that makes a lot of sense. And then what did you find? Like what changes did you observe over the course of those sessions?
Yeah, so pre to post treatment and all the weeks we saw a reduction, and then in all across the board, range of motion increased, and then pain and fatigue decreased. And then we actually saw a like kind of like a linear drop from like the first week to like all, of course, the 6 weeks. We did see in the final week a little bit of a spike, but it's likely that that was probably due to her being due for a round of medication.
Okay. Yep.
So that kind of was like limited us a little bit. But we were still very encouraged by seeing like this like linear progression over the course of the 6 weeks and then before and after each treatment as well.
So exciting to actually see this working with a patient. As we kind of think about how this fits into the literature, like what does this case really add to what we know about massage for people with MS?
Yeah, I think the fact that we found something that really helped the range of motion is huge. And considering like the progressive and chronic nature of the condition, I think it's really promising to actually see that we can improve something over we only did 6 weeks, but the fact that over 6 weeks we were able to improve the range of motion and she was seeing changes in her day-to-day life. I think that was really important. There's so much already out there about fatigue and pain and
Yep.
Swedish massage, but I think it's really important to find just something for the range of motion,
Yep.
especially considering how young people are diagnosed with MS.
Mhm.
With like most people are diagnosed in their late 20s, early 30s, and they have so much life left to live, and I think keeping their mobility up is really important.
Yeah, it's wonderful. What can other therapists take away from your experience and apply in their own sessions tomorrow? Like, is there anything that you can share with folks that are listening that work with
Yeah.
patients with MS?
I kind of like something that I would like to do now that I've done this. I want to add some fascial technique in there just to see if like what else it can do. I think the biggest thing though was like don't be scared to just try something
Love
because
it.
like if like I there's nothing out there saying to do PNF for MS, but like we did it anyways and it worked. So I
Yeah,
think
and there
like
was a
just
rationale for using it. Um,
yes.
yeah.
So I think a lot of just like try it out and see what happens and go from there kind of thing.
Mhm.
But yeah, I think definitely try some fascia release. I think knowing what I know now about her, and I
Mhm.
have seen like a few other MS patients since doing my study, I think it would be the next thing I would try.
Yeah, I like that. You're approaching it from then kind of like re-educating the neuromuscular system, but then also creating some room in the fascial matrix to be able to
Hmm.
like allow her to increase her range of motion. As we close here, just curious, what's next for you? Do you see yourself continuing research or building on this work at all? Or yeah, what are you looking forward to doing now that you're graduated and a massage therapist?
Yeah, absolutely. So, I'm now working at two clinics. I worked at Back to Alignment in Fort Saskatchewan and then Park Massage in Sherwood Park. So I'm kind of outside of Edmonton now in some smaller communities, which is exciting. Um, it's actually kind of interesting. Right before I started the study, a few years prior, we actually lost somebody very close to our family to MS.
Mm.
So it kind of
Mm.
really hit close to home when
Wow.
this opportunity came up. And I have some family members now with MS, so I'm definitely very passionate about continuing what I'm doing. I've actually started to like reach out to like MS societies around me,
Wow.
and I'm going into a couple high schools coming up here to actually present my research, um, and
Amazing.
show some like basic PNF techniques to some high school kids. So I'm pretty excited about that, and I'm definitely like looking to like expand my clientele. I mean, right now I'm in a very like I'll take any kind of client right now. I'm
Mm-hmm,
starting out, I'm
mm-hmm,
kind of doing the nitty-gritty work, but
mm-hmm.
I'm definitely excited to kind of hopefully get more pa MS patients into my
Yeah,
clinics. I have a couple
specialize.
right now. Yeah.
Yeah.
So I'm definitely very passionate about continuing to see where it takes me. I mean, when I started this case study, it was an assignment at school, so
Mm-hmm,
I never would have imagined that we are where we are now, but
mm-hmm.
it's exciting. And I think the more I work on it, the more find out new things about it every single day. So I definitely don't see
Wonderful.
it ending soon.
Yeah. Oh my gosh, you did such an incredible job, and we're so lucky to have you now as a recent grad in the field of massage, and really looking forward to seeing how you grow this in the future. So thank you so much for taking the time to meet with us today. And thanks everyone for listening.
Of course, thank you for having me.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.